afternoon, everyone, and welcome to our Back to Basics webinar series.
Is being recorded.
For those of you who have joined us before, we're glad to have you back. And if this is your first time joining this webinar series, we're also glad that you've made it here. We ask that you please take a moment to enter your name, your organization or facility, and your role in the chat so that we can get to know everyone who is joining us for today. My name is Andrea Boucher with Superior Health Quality Alliance, the Chronic Disease Management Team, and I will be your facilitator for today's session. As I mentioned, today's session is part of a webinar series. Our webinars are on the third Tuesday of each month from 12 to 1 p.m. Central and 1 to 2 p.m. Eastern. On this slide, you can see some of our future topics that we'll be discussing over the next few months. Our next session in February is going to be covering cardiac rehab. In March, we will be talking about healthy living with chronic disease. And in April, we'll be focusing on end of life and advanced care planning. Please note that some of these sessions may be subject to change if there is important or sensitive information that comes up. And we also always welcome any suggestions that you might have on future topics that you would like to hear about. So please feel free to reach out to us if there are any topics that you want to hear. But with that, I am going to turn it over to our speaker for today, Rachel Dibble. Rachel, the floor is yours.
Thank you so much, Andrea, and good afternoon to all of you who joined us. Thank you so much. So today, our learning objectives are assessing your patient's readiness and confidence to change using motivational interviewing techniques, setting specific, measurable, achievable, relevant, and time-bound, otherwise known as SMART goals with your patients, and providing positive reinforcement and feedback, assessing barriers and challenges to behavior change, and referring your patient to appropriate resources and programs. Next slide, please. So the idea of this talk and this question, and I'll read the question first, is how often do you review your patient's healthcare SMART goals with them? And the reason why we ask this question and the topic of today's talk is, what are your New Year's resolutions for your patients? So we often ask them about what are they for ourselves, but as providers or administrators or anyone in healthcare, maybe it's a good time to reset of what are we going to do different for our patients? So that's where this question has come from. So just throw in the chat some things that you're thinking about in reviewing your patient smart health goals with them. Or is it something on the docket? That could be something to think about as well. So readiness to change concept. As we know, getting people to change behaviors is the hardest thing to do. And that could be anything. So knowing that, so there are models called the readiness to change concept. And so there are stages of a change model concept. So again, as we know, most people do not change any behavior quickly and decisively, and they move through a process of change, often toggling back and forth between stages or spending years in one stage before moving to the next, etc. And then they are on the bandwagon of change. Then what happens often is relapse. And this is common. And so the person returns to one of the earlier stages of change, and potentially they could get stuck there as well. So there is a process in one's psyche for the readiness to change concept and or model. Next slide, please. So what is it? So this is a change model framework. This is tried and true. This is absolutely what it is. So it is the pre-contemplation stage, the contemplation stage, preparation stage, action stage, and maintenance stage. So when you see these 5 concepts, what you want to do initially is see where your patient is, and you get that information from listening to them of where they are and whatever it is they want to change about their health life. Next slide, please. So when you're assessing readiness to change, so the question could be potentially, if you are willing, I would like to ask you some questions to find out how ready you are to change, maybe getting some exercise, maybe eating less carbs. Maybe it could be really anything. And then the patient's readiness to change evaluation tool, which is usually it's a Likert scale. It's a standard resource, which we also have for you at the end of the talk. So you can discuss behaviors, conditions. The big key here of why this is important, it is the quality of life. So sometimes I feel like when we talk to patients, we can get lost in why we're trying to get a change to happen. But if we can get our patients to understand that potentially a change could impact in a positive way their quality of life, there's some buy-in there for the patient. Assess importance of changing X. So again, using the Likert scale is a real easy, if you don't have like the tool in front of you, it gives you a great sense of where they are. So the example would be on a scale of 1 to 10, with 1 being not important at all and 10 being very important. How important is it to you now to stop smoking or eating carbs? And then that's how you open the conversation. And people, when they really think you're interested in listening to them, oftentimes they just want to be heard. And you're doing a great quality of life exercise for them if they are just being heard. It does a lot for them. Next slide, please. So assess confidence to change. As we know, any kind of change from a psychological perspective takes a lot of courage. You got to identify it and you got to have the courage. And then once you have the courage, you have to have the confidence. So if you're constantly relapsing, your confidence level is going to go down. So the idea is to have really small, measurable goals for your patient with your patient so that you could say, how was it when you walked 10 feet on a scale of 1 to 10? It was a 10. They're going to want to walk 12 feet tomorrow. It's just how that momentum works. So on a scale of 1 to 10, how confident are you that you could quit in this example would be drinking? Okay, on this scale, 1 means not confident at all, 10 means totally confident. So really make sure they understand that, because sometimes 10 means not confident and reverse. And what you're trying to get through this slide and the slide before is the importance of change and the confidence to change. So when you have these two things, that's the goal between these last two, this slide and the one before. So your results are, to your patient, you scored a 9 on importance and a 4 on confidence, which tells me you think it is very important to change your behavior X, but you're not sure how you're going to go about changing the behaviors. Does this seem accurate to you? Or, next slide, please. Or more something along the lines are, potentially, you scored a 3 on importance and a 7 on confidence, which tells me you do not think it's really important to change because their importance is lower than their confidence, obviously. But you think you probably could if you wanted to. So that shows they have the confidence to do it, but they don't think it's important, right? So you have to work with their confidence and importance. Again, the goal is to get them probably at a 7, 8, 9, 10, right? So you also said you were 1 out of 2 because you thought it might be true that X could be bad for you. You're just not convinced that some of your behaviors are harmful to you. Does this seem right? So you don't want to misinterpret what they're saying. You want to ask them, truly, am I hearing you correctly? I really want to empathetically and compassionately know that I understand you. Next slide, please. So what are SMART goals? These SMART goals are wonderful goals, I think, universally, but in particularly for your patients. SMART goals are, the why behind SMART goals is it tells you exactly what to do, measures it, how comfortable are you achieving, how realistic, and how timely. And it gives you some sort of framework and guide and plan for the patient, which is why these goals put together with your patient is really important. So they have, again, skin in the game. It will build confidence when they actually achieve these. So what is specificity or specific? So what exactly will I do for a specific goal? So we're going to say this patient was on opioids and wants to get off. and their providers tapering them off. They're working together their SMART goals. So that's the history behind this example. So what the patient is asking, what do I do? Or asking the provider, I'm asking the patient. So they're saying from their other consultations, the plan is to taper off slowly. I say that's wonderful. For how long, how many, and how much? What is the plan here? What the patient is saying, I will cut back by half a tablet by the end of the month. So if they say I will cut back by the end of the month, that's not measurable. It's how much are you going to cut back, which is a half a tablet. So that's the key right there. That's the measurable part. Achievable. What do you feel comfortable with achieving? The patient says, is taking baby steps okay? That's perfect. Walk 5 feet. That builds confidence. And more so than importance, confidence is really what you're aiming for with your patients. Realistic. What have you done before that has worked? What have you done in your life that worked when you tried to change something? It could be trying to change a driving pattern to your old job. It could be something as simple as that. So this patient said, I did this after my last surgery, meaning they tapered off their meds. That opens up that conversation. How did you do that? What worked? What didn't work? Then you can set that realistic goal with your patient. So when are you going to start doing this? Maybe the patient isn't ready to change until next Monday because they know they have PT tomorrow and the next day, and they don't want to be in a lot of pain. So we did it together. We know your schedule. So we have this great plan together under a SMART goal. So for your patients in your new year, this could be a wonderful way to start with their SMART goals. Next slide, please. Motivational interviewing. This is really the evidence-based way to go about learning about your patients, establishing collaborative plans of care. Collaborative, that's the key word there. So motivational interviewing, this is the absolute definition. Motivational interviewing is a collaborative, empathetic process that respects patients' autonomy and inspires patients to find motivational change. So that definition is really what it is. We want to respect what they can, what they can't do. We want to help them come up with ideas, innovation, creativity to get to their goal. That's how we help them. So why does it even matter? So it is a crucial skill set, and it is a skill set. It really is, to create more rewarding and effective clinician-patient interactions. And that's the other key here, and that's trust. Motivational interviewing builds trust. Your patients and you will go down a journey together, not independently, if you all trust each other, meaning the provider has to trust the patient too. It's a two-way street. Useful foundation for guiding patients to change behaviors. Data helps a lot. Health literacy, key in motivational interviewing. Medical jargon, 90%, 95% of the people just don't understand. So that's something to be very mindful of as well. Next slide, please. So the pre-contemplative state, when you looked at those 5 stages of change, the first stage is the pre-contemplative state. And each stage can be for a minute or it can be for 2 years. We don't know. And then that's where your motivational interviewing, uncovering, peeling back the onion. That's why that skill set's so important. So what is the pre-contemplative stage? So in your opening interviewing skill set, you want to ask open-ended questions. So pre-contemplative means that they're thinking about change, meaning, it might be good for me to just start walking like a couple of feet. So the patient's starting to think about this. So what would happen to you to know that this is a problem? These would be the open-ended questions. Why would the lack of exercise to you be a problem? Because you're trying to guide the patient to their own answers, right? What warning signs would let you know that this is a problem? So insofar as walking, I can't even stand up anymore. I'm so weak. So I think maybe if I start just walking a little bit, I'll get stronger. That's the correct answer, right? So have you tried to change in the past? Yeah, I tried, 10 years ago to just try to walk the dog once a day. Well, tell me about that. What worked? How did you do that? There you go. Then hopefully we'll get them into the contemplative stage. And that's the next slide, please. So what is the goal? So the patient will examine benefits and barriers to change. We don't walk the walk of their lives. They have to tell us what they face every day for them to be successful, for us to help them navigate all of these barriers potentially. So patient will examine the benefits and barriers. So why do you want change at this time? That's a great open-ended question that would maybe lead them to a contemplative actual change stage. That's what we're trying to get to the next stage. What would keep you from changing at this time? What are the barriers? Maybe they have to have a family member with them because they've fallen so many times. That family member can only come Thursdays at 10 a.m. So right there, we know a lot right there. We know about family, we know about accessibility, and we know about safety. What might help you with that aspect? What things, people, programs, behaviors have helped you in the past? What would help you at this time? What do you think you need to learn about changing? None of this is punitive. It is us being investigators. I like to think of myself as Sherlock Holmes when I do motivational interviewing. I'm trying to find out information, and at the end of the day, my patient knows I care about them. And you will be successful in this skill set with that premeditated mindset. Next slide, please. So barriers and challenges. So when we get into barriers, potentially the patient is not prepared to change, and they will have to sit in that pre-contemplative state, hopefully with us, nudging them to move on to the next stage. Financial, always a barrier. Access to medical care, always a barrier. Food deserts, big problem and getting bigger these days. Patient compliance with medications, limited family and friends, transportation, isolation, depression. These are massive barriers insofar as patient care, getting care, and dealing with attempts to change. Next slide, please. Positive reinforcement. This is another key takeaway. If we are not celebrating our successes with our patients, sometimes it's just one person that they have in their life, and that's it. And it may be the provider, it may be the nutritionist, it may be the administrator, it may be, who knows? But everyone can say, Mrs. Jones, you're doing a great job. You look better. You look more spry. I mean, I don't know what you're doing. That it's those nuggets, it's those spiritual connections, soulful connections that keep people motivated enough to change. It's like weight loss. Someone who's lost 15 pounds, man, you look great. They're going to keep losing weight. But if people are like, yeah, I can't tell, you don't look great, then who cares, right? It's the same idea. So we must celebrate. We must celebrate self-monitoring, what patients are doing for themselves. Huge. Compliance, huge. Smart goals, big. And problem-solving skills. They may not be able to solve the problems. They need to come to us for problem solving. We can help. Next slide, please. So here is the summary. And I'd really like you to think about it. What is your New Year's resolution for your patients? What are the things you think that would improve their quality of life? Maybe they're not ready to change yet, but maybe you could entertain it and let them know that, hey, I've got a way that maybe I can walk you through the journey of change, and let's try it together. So the things that we really want to think about is we are our patients' advocates. We need to see where they are in their readiness to change. We need SMART goals. We need to be able to tell them where to go, how to get the resources that are there. Team approach within your facility with all stakeholders. Anyone in the healthcare landscape is important. It doesn't matter what you do. Celebrate your patients. Motivational interviewing. Maybe you have some exercises in facilities in particular for role playing. It's really super helpful. And then positive feedback with your team. Thank you for catching that. That was a great catch and great ideas. I was really stuck on getting food to this woman, but that kind of community collaboration within your team and with your patients leads to success. Next slide, please. So, what is your New Year's resolution for your patients? Just collaborate with patients, your SMART goals, plan of care, team approach, listen, resources, and other. And I don't see responses, so I'm not sure where I am on this. Okay, thank you. I love it. Thank you so much. So we have 38% collaborate with peers, 25 create SMART goals, 25 create a plan of care with my patients, 25% use the team approach, 25% share resources with my patients, and 38%, I love it, listen with intention. Because the patient will give you everything you need if we listen with intention and ask the right questions. Thank you. Next slide, please. So here are some of the resources that I talked about. I'm usually kind of lean on resources because the resources I give, I want them to be a big value. So these two resources you will glean a lot of information from if you would like to review them. Next slide, please. So I'm going to turn it over to you all. Any comments, questions? I would love to hear from you just in general about what, if this is something you've done in the past or if it's helped, like just your thoughts in general. It helps us as well to know where you are and if this was valid and if you think this is helpful or need more information or anything. Okay. So I don't see any questions in the chat. Okay. And then in the chat, there is the link to the slide deck that was presented today. Okay. Next slide, please. And again, my name is Rachel Dibble, a quality improvement advisor with Superior Health. This is my contact information. So if you would like to email me with any comments or questions, I'm so happy to just give insight or some ideas, thoughts, innovation. And we're here to support you and help you. So just please reach out and let me know.
Great. Thank you so much, Rachel. I'll go ahead and if there are no questions, I will go ahead and wrap us up for today. Just a few more things we wanted to make sure we covered. We do have an event evaluation. There is a link for this included in the chat, or you can use the QR code that is on this slide. So I'll leave it up here for just a moment in case you wanted to capture it that way. But we really do use the feedback that you provide in these evaluations to improve our future events. So we would love to hear your feedback on today's session and any feedback that you might have, ideas for us on future sessions. So please fill this out as soon as you can, and we'd love to hear what your thoughts are. We also have some other resources available to you, and these links are included in the presentation slide deck that was included in the chat. We have our Shine a Light on Stigma campaign. So if you're interested in taking the pledge for this campaign, the link is on this slide. We also have a lot of resources related to chronic disease highlighted on Superior Health Connect. So we would love to continue this conversation with you, and the link for Connect is on this slide. If you're not already a member of Connect, it's our shared learning environment where we do post resources and other information that might be pertinent to chronic disease management and other areas that we work on at Superior Health, and really where we promote an all teach, all learn climate. So we encourage you to join the conversation on Connect, where you can access some additional resources that way. We also have our documentation and coding guides for various conditions highlighted on this slide, and also our Food First, Using Food as Medicine resource library, which is available through our Connect platform as well. Just a reminder that our future Back to Basics topics are listed on this slide. I mentioned these at the beginning of our session, but all of these Back to Basics sessions are on the third Tuesday of each month from 12 to 1 Central, 1 to 2 Eastern. So we hope that you're able to join us for one of these future sessions. And just some last next steps if you haven't yet registered for our future webinars, you can do so using the registration link, or if you'd like to share that with any colleagues, you can do that using this link on this slide. Again, a reminder to sign up for Superior Health Connect. And if you're interested in receiving any one-on-one assistance from Superior Health, please feel free to email Jerry Hineker. Her email is listed on this slide, and we're more than happy to get you connected to any resources that you might need or any questions that you might have. We're definitely here to help. So please feel free to reach out to us with any questions that you might have. But I will go ahead and pause and see if there's any final questions or comments before we wrap up for today. All right, well, hearing none, I just want to thank you, Rachel, for your time today and your presentation. This was wonderful information. We appreciate you sharing it. And thank you, everyone, for joining us today. We hope you have a great rest of your day.